Okay, so let's look at the final part for the treatment sequence when we're talking with ITB. We're going to be doing some taping here. We're going to use the rock tape. So we're taping to offload. So we're going to start below the knee. So you're going to need a very long piece of the rock tape, and it's really important that you measure then cut. Okay, if you measure too long, then you'll end up over here, which is not ideal, and if you measure too short, then you won't cover the areas that you need to. So I'm sort of going to use basically just below the head of the fibula, and if you run the tape to the greater trochanter, that's about the distance that you want to cut your tape, and then make sure that you round the edges. All right, so we're going to tape from below here around about Gertie's tubercle. We're going to run the tape all the way along the ITB itself. We're going to come over the top of the greater trochanter and probably end up over here towards the iliac crest. We're going to decompress at two sites, one up here at the hip, and then two down obviously where the side of the pain is for ITB. Now, keep in mind that when people come in with ITB pain, one of the classic symptoms for ITB pain is not only where the side of the pain is, but that they can't run through the pain. Okay, ITB is very, very difficult to run through the pain. It actually stops you. So that is a classic symptom to keep in mind when you're dealing with ITB. The other thing is too, sometimes people can jog for a little while, then the pain increases and then it stops them from doing what they're doing. Whereas if you sprint, you can actually get away from the pain. And the reason for that is the idea is that the actual ITB drops more posteriorly when you sprint, but as you jog it comes anteriorly, and it's a lot more painful as it comes anteriorly. So we need to keep that in mind when we're taping, because we're going to tape more towards the anterior than to the posterior. And that's why we've got the leg in a stretch position here, like so. So I'm going to place the anchor down just below that Gertie's tubercle. We're then going to peel off the backing tape. Now it gets a bit tricky here because remember we're using our ratios for stretch. That's 100. We want to come back. We're going to use about 30 or 40, but we need to come down and around, and then we need to direct the tape up in line. So you have to come around. Literally, it's almost like a corner, but we're not going to take it too much. We're not going to increase the angle on it too much because we'll miss the area that we want to tape. So we come back up, over the top, okay, anchor off, and then basically finish off just at that iliac crest, okay. Make sure you give the tape a good rub, okay. The idea is that activates the adhesive and obviously makes it stick so much better. Okay, so we've got two decompressions. As I said, the first one's going to be up over just above the greater trochanter. So we're going to run a decompression right across here. So that's about 80 or 90%. Peel off your backing. Okay, then we'll come down to the actual side of the pain. So this is where you have to palpate and make sure that you've got the area of pain where they feel it. As I said, it's not particularly right in line with the joint line. It's actually down a little bit further towards more that fib head. So make sure you palpate it right, get it right area. Once again, same sequence again, 80, 90, decompress, peel off your backing tape like so. Give it a bit of a rub, activate the glue, the adhesive, and you're done. Okay, so to recap, we're going to start from here. Remember to cut your tape, all right, fib head to the greater trochanter. Then obviously anchor it here just below Gertie's tubercle, run it up and around across the lateral part of the knee, up over the greater trochanter. You want to end up at the iliac crest, and then you're going to decompress right just above the greater trochanter and then right over the side of the pain. Okay, simple.